Good morning, USRNs. Today we will talk about skin disorders. We have psoriasis, impetigo, herpes zoster, and scabies. The first one that we will talk about is the psoriasis. Psoriasis, there is a production of epithelial cells, and those epithelial cells production are being increased. So, tumataas yung level ng epithelial cells. That will lead to silvery white scales on a reddened round plaque. Again, there is an increased production of epithelial cells that will lead to silvery white scales on a reddened round plaque. This will result to pruritus or pangangate and an uncomfortable feeling. The risk factors for psoriasis are autoimmune and stress. So psoriasis pala si stress. So wag na ma-stress, ha? Sabi nila dito, we need to manage it with corticosteroids, obviously because it's an autoimmune disorder. And to address stress, we need to do some stress management. Also, we can instruct the patient to do testing like this skin test, wherein we will test the PUVA, which is the psoralen ultraviolet A, which is a photochemotherapy. Again, the skin test for psoriasis is psoralen ultraviolet A photochemotherapy. So para hindi makalimutan yung skin test for psoriasis, I created a word there to help you remember it. It's PUVA psoriasis. PUVA psoriasis. PUVA psoriasis. PUVA psoriasis. PUVA psoriasis. Okay, next on the list, we have impetigo. Sa impetigo, there is an infectious GABHS. That's the cause of this skin disease. Group A, beta hemolytic streptococcal. Group A, beta hemolytic streptococcal. So para hindi makalimutan ang cause ng infection for impetigo, it's gonna be empithegubs. 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 Group A, beta hemolytic streptococcal infection. The management for impetigo is contact precaution. So sa contact precaution, we can use gloves and gown. So contact GG. Contact GG. Of course, patients should have a proper hygiene and encourage antibiotic because this is a bacterial infection. What are the symptoms of impetigo? It's a bacterial infection, so we expect that the patient will have a fever and a sore throat. That's autocorrect and NCLEX. And the crusting would be honey-colored. So the patient will have a honey-colored crusting. And of course, a very itchy skin, which is pruritus. Alright, USRNs, the next would be herpes zoster. Herpes zoster. Herpes zoster happens when there is a remission of varicella virus or the chickenpox. Herpes zoster happens when there is a remission of varicella virus or chickenpox. This affects from low immune system. Remember that the herpes zoster dormants in the spinal nerve and cranial nerves. So kapag nagising yung virus na si herpes zoster na nagtatago sa spinal nerve and cranial nerves, that's the time that you will experience the virus of herpes zoster. It goes to cranial nerve number 7 That will lead to Bell's palsy. It goes to cranial nerve number 7. That will lead to Bell's palsy. Again, if we're talking about Bell's palsy, always remember that it has something to do with cranial nerve number 7. So para hindi makalimutan, you can remember it on a way that you will make dugtong, Bell's palsy with 7. So that's going to be Bell's pulse 7. Bell's pulse 7. What are the symptoms of herpes zoster? Of course, there is severe pain, no appetite or zero appetite. There is a burning sensation on the trunk. Patient will also have body malaise, and patient will have fever. Again, the signs and symptoms of herpes zoster is severe pain, zero appetite, burning sensation on the trunk, signs of body malaise, and fever, or the temperature rises. We need to encourage the patient to be in an airborne precaution. Airborne precaution, we can use N95 and HEPA mask. Airborne precaution, we should use N95 and HEPA mask. The room should be private with negative air pressure. Other management for herpes zoster, we have nutritional supplements. Kasi nga, mababa yung immune system niya, we need to supply nutritional supplements to our body. When it comes to medication, we can give antipyretics. All right, let's move to the last one, which is scabies. Scabies. This is also a skin infection, and this is highly contagious. This is a skin infection which is highly contagious. The cause of it is Sarcoptes escabeie. Parang escabeche. The cause of this is Sarcoptes escabeie. It's a family lice. You need to assess patient for thread-like lesion or burrow, B-U-R-R-O-W. Yan yung makikita nyo sa choices sa exam. Thread-like lesion or burrow. Pwede maka-burrow ng scabies from your dog, arte. Meron ting pangangati syempre, assess for pruritus. Ito yung tinatawag nilang galis aso daw eh. Now, the precaution for this patient is going to be contact precaution as well. Again, kapag si contact, we need to use gown and gloves. Contact GG. If you have a problem with precaution, contact GG. Let the patient apply permethrin lotion. Permethrin lotion. Neck below, and let it stay for 2 to 3 minutes and rinse it well with warm water. The effect would be altered level of consciousness, lalong-lalo na sa pedya. So kapag may scabies si patient, that will lead to altered level of consciousness, lalong-lalo na sa pedya. You should also treat not just the patient, but all other family members. So you need to wash their personal belongings like the linens with hot water. So again, the treatment should not only go to the patient but to all other family members. You need to wash their personal belongings like the linens with hot water. Thank you for listening.